Welcome back. We have Andrew Petersen from the Holtorf Medical Group, and we are asking him about supplements. I was just discussing with you supplements while you're pregnant, supplements when you're not. Can you take too many?
Absolutely, you can take too many, but you should. Here's the thing, in the American diet, it's well known that there are not enough nutrients and vitamins, and that's because mechanized farming, industrialized farms, GMO, pesticides, herbicides, over all of those things, our foods are processed, right? So then they have to put back in vitamins. So yes, you can take too many, but almost no one does. We mostly take too few.
What if you're taking none? Right now, what should you be taking?
Well, here's the thing. I like to think about Hippocrates. Hippocrates is widely called the father of medicine. He is most famous for saying, "Let food be thy medicine." Now, that's important. Food should be our medicine. But in medical school, so the father of medicine says this, in medical school, the curriculum today, only 1 credit hour in 4 years is dedicated to nutrition. So your physicians, who should be telling you about nutrition, got 1 credit hour in that. They don't really have a chance. If that's all they taught us, how are we supposed to teach you as our patients unless we individually go out and find out that information? And yet we know that people's diets is poor in nutrition, right? In vitamins and minerals and those sorts of things. So just like in anything else in life, it's hard for a consumer to know what's safe, know what's effective, know how to take it on an empty stomach, after food, what things like that, how to interpret the labels. And so if you can find an expert to help you, I think you get a much better product.
Is everyone different? Should I be taking something different than Brianne and you?
Potentially.
Okay.
To some extent, there are basic things that everyone will benefit from. Depending on if you have a particular diagnosis or your age or your gender, then that can be different.
So here's a question. If you take a prenatal, I'm going to say pregnant, this goes for both, and you're nauseated, is there a reason you're nauseated and should you not take that?
Well, the reason you're nauseated is because you're pregnant. And vitamins can be difficult for us to take anyway.
Because
and so then
the
you're
pill
more
is this
nauseated.
big. That's why I'm nauseated.
Yeah.
That can happen.
It can. Here's one of the things that I find the most, that people that know that supplements are important for them, that know that their diet isn't rich enough in it, they come to my office and they bring this big box filled with supplements. And they have a bottle of vitamin B and a bottle of vitamin D and a bottle of vitamin K and a bottle of calcium. It's just this huge thing. Dr. Holtorf, our medical director, for the past 10 years has developed and tested and given patients hundreds of natural products in conjunction with the typical therapy. And so he knows what the best things are and the best natural products, and he's been able to combine them into some supplements, which I think then you're like, okay, now I don't have to take 25 things. I can take these 2 things because it has all of it in there. And I think that's important. But to that end, there are things that people should probably avoid. Maybe they're allergic to corn or they're allergic to wheat. Yeast is something you want to make sure is not in your supplements. So yeah, there is individual needs as well.
So what should we all try and take?
So I was going to say, when people come in, what do you see most often that you say you are deficient in this? You need to take this.
Well, anybody, and the CDC has said this, pretty much anybody that lives north of Atlanta is going to be deficient in vitamin D. Because now, it's always said vitamin D comes from the sun. The little vitamins aren't radiating down on the wavelengths, or the waves of light, right? What happens is the UV radiation triggers your melanocyte to tell your liver to make vitamin D. Turns out it's not a vitamin at all, it's a hormone. It's made in our body. So everybody that lives too far north doesn't have that angle of refraction for the UV radiation, they can't make enough. So pretty much everybody needs vitamin D. And it's not just for your bones, it's great for your bones, but it's also for your energy and your immune system and your balance. Another thing beyond vitamin D, omega-3 fatty acids. The #1 cause of death for men and women in America is heart disease. And omega-3 fatty acids are probably the most helpful thing that we could take to prevent heart disease. And you need to take 4 grams. That's fish oil. What happens is people buy it and they're like, oh, the doctor said this was good. And they take 1 or 2 once a day. Well, you need 4 grams to meet what the studies have shown is helpful. And 8 grams if you want to get the very most benefit. That's a lot of fish oil.
And not all supplements created equal.
No, absolutely not. The most important thing to look for in a supplement is quality. You know, if I go to the grocery store, you go to the grocery store, I can tell what the fresh broccoli looks different than the wilted broccoli. I can tell a big apple from a little apple, but you look at a bottle of supplements and you're like, I don't know.
I guess, yeah.
Right? So quality is by far the most important thing. And there's some things people can do. There's a website called consumerlab.com that you can join, and they will show you what things have been tested. Are there impurities in it? Is it corn or wheat or yeast based? what are how to help you read the label, those sorts of things. So there are things people can do just at the grocery store to know that they're getting a good supplement.
And this is such good information. All things that we all need to know.
Well, and important because it's your health we're talking about, right? What you're putting in your body. If you have questions that you want answered, don't forget the Holtorf Medical Group is in Provo, 524 West, 300 North, holtorfmed.com for more information. That's their website. Or go to ours, abc4.com, and just click on that Daily Dish box, or you can go /Daily Dish. We'll make it easy. All